I want to talk to you about Lasik. Lasik is a great procedure. I had it done 25 years ago. As you know, I wear glasses currently, and that's for reading. These are no-line progressive bifocals, so I can see across the room. But let's get back to Lasik, and Lasik being primarily for nearsighted people. We know that the front of the eye where the contact lens sits on is the clear window that's in front of the blue, hazel, brown part of your eye is the cornea, and that is we call it a 550-page book. And simply enough, LASIK deals with having a laser that creates a flap where we open the book to page 150 approximately. We are going to remove a certain amount of pages based on your prescription of that book. So we're going to take this book and go from 550 pages, and let's say we're going to go down to 500. Typically, it's about 10 to 12 pages for every unit of prescription you have. This procedure will take less than 90 seconds, where I'm actually going to fold the book or close the book back up, and like that, you're seeing about what you're going to see in 3 to 5 days. Most people report excellent vision the next day. You can go to work, you can do pretty much whatever you want. No swimming for a week, you're on drops for 5 days. You'll end up seeing the surgeon that day. You'll see myself at day 1 and day 5 to 7, and then at 1 month, 3 months, 6 months, and a year, if necessary, based on the flap. The cost of the LASIK is $3,900. That includes a year of follow-up care and any enhancements needed for the first 5 years. The enhancement rate, meaning if you have to go back and get it touched up, is 12%. Which is not very common. The higher the prescription, the higher the chance you have an enhancement rate. But LASIK is a great procedure. It's been around for over 30 years now. It's safe. The reason, again, I wear glasses is after the age of 45, we lose the ability to focus. So this lens, which is being, in a younger person, changing shape and able to focus here, 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 doesn't work at 45 as well, if at all. Thus, I have to wear glasses, not for distance, but I choose so I can see my patient across the room, as well as my chart or anything up close, my phone. That is how I have to wear glasses. But as soon as I'm done with work, golfing, working out, driving home, my glasses are off. So, again, LASIK is a great procedure that is non-invasive. As long as we don't go past page 300 in this 550-page book, there's no scarring. Some of the side effects on LASIK can be dry eye or night glare. Not very common. Things can be fixed, but because you're changing the shape, that night glare can be an issue for up to 3 months. We're going to be making sure that your tears are adequate and those things. As far as dry eye goes, we do not want to do LASIK if you have a severe dry eye to begin with, because we could make it worse. But most people will use drops for the first month here and there to have their eyes feel a little bit better due to the LASIK going in and deadening the nerves a little bit, so it takes a while for those nerves to come back. To finish up on LASIK, nearsighted is somebody that has the image focused here. Somebody that's what we call 20/20, the image is focused here. Somebody that's farsighted is focused here. These eye muscles can only bring the image forward. Thus, that's why somebody that's nearsighted will always be able to read their entire life, because it's focused there. That's where you need to have the spot when you're looking at something clear. LASIK will push the spot from here to here, and you become what we call 20/20, and then require reading glasses after the age of 45. Some people will get monovision done in LASIK after the age of 45. I don't recommend LASIK really past the age of 50, because we can accomplish the same thing with cataracts by taking the lens out and replacing it with your glasses or contact lens prescription. But again, it's a great procedure from anywhere from 20 to 50 years old. On LASIK, as you get more serious with that, a lot of people use flex dollars through their employer, but you are required to be out of contact lenses for 2 weeks before the examination with me, which would require dry eye testing as well as a dilated eye exam to get your true prescription. So 2 weeks without contacts, you come back see me. The surgery is usually already set up for 3 or 4 days after the fact, and at that point you'll see me the next day and you're off and running. You will wear a shield typically the first and second night based on eye rubbing. We don't want that to take place during the night when you're sleeping.